Hello, Joe 200. How are you? It's Tuesday night, October 2nd. So we're in October 2018. Halloween's coming. So we are finishing up our biology sections. We last week had a great discussion on and really informative information about diabetes. This is a big problem with the obesity epidemic. They call it metabolic syndrome. Um, and diabetes is the primary player, the primary underlying cause of all kinds of sickness and health problems and death in our country, and in kind of surprisingly, in all of the industrialized countries that do not keep things like diet and obesity in check. Okay, it is a condition of excess, and so those countries that practice, the Mediterranean diet and fasting and regular exercise don't see the kind of problems we see in our country. Um, I'm making big generalizations. Obviously, there's huge swaths of our country that do everything right in terms of diet and exercise, but there are a lot of parts of our country that do not. Different cultures, different regions, and things like that. Okay, so you guys did a great job in CT1. We've gone through and looked through them and graded them. I think it was really fun to see your interpretation of looking at really kind of very different countries and thinking about um, the socioeconomic reasons as to why um, Nigeria and Guatemala are so different from, say, Australia and the United States. And so it really gets you kind of thinking about the lack of uniformity that's out there in the world. And the stuff that you learn in this class and the stuff you guys will be learning in your specialties in business or whatever are going to have direct applications globally. People look to USC graduates to answers to their problems, and a big problem has to do with aging, where a lot of these countries really didn't anticipate this. It's kind of a consequence of modernization hitting countries that were not developed, and so suddenly um, um, they get a lot of the benefits, the tools of modernization, like improved healthcare, whether it's nutrition, whether it's hygiene, things like that, and the things that used to cause large segments of the population to die, they don't. And then suddenly you have this enormous chunk of people that are old, and then oftentimes suffer from some of the chronic diseases of aging that we've been going over. Okay, so um, to the course quiz and readings this time. So it's just a follow-up on diabetes. So we go from diabetes here, okay, into diabetic heart disease, okay. And what we do again, just in case you're having issues with accessing the link, we download all these segments of the course as PDF files, okay. So you have your choice, to go in and click on the PDF file and go ahead and read up on diabetes and diabetic heart disease and this condition called atherosclerosis, okay? And you can actually save these to your own desktop if you wish. It's a great resource. Or you can just go to the National Heart, Lung, and Blood Institute website where these individual chapters were accessed from. So again, this is the same exact information, but it's just in a web-based format, okay? Alrighty, so we've already talked about diabetes, type 1 and type 2. Type 2 is by far the most substantial one. Type 1 is a juvenile diabetes where unfortunate individuals have an autoimmune disease that destroys their insulin-producing cells in their pancreas. Type 2 diabetes has a really large genetic predisposition. If you have it in your family line, then you're really high at risk. But it is connected to lifestyle as well. So if we look at overnutrition and obesity, we release hormones, insulin and IGF-1. They drive cells to grow, and this includes our fat cells. And when the fat cells grow, they become their own endocrine organ. They produce these fat hormones that lead to insulin resistance. They also have immune system cells that get in there, and they kind of cooperate together to produce what are called inflammatory messengers. And these inflammatory messengers, along with this change in hormones, cause a resistance of the insulin receptors to when insulin binds to it. And so what happens is the glucose no longer, or not as efficiently, is drawn into muscle tissue, brain tissue, all the tissues of your body. And that elevated glucose out of the bloodstream is completely abnormal, and it then unto itself triggers abnormal growth and inflammation. So it becomes this downward spiral of growth and inflammation. We heard a bit about it in the aging theories with insulin and IGF-1, and then inflammation. These messengers that our immune system produces, they're called inflammatory cytokines, and these in combination cause growth of the atherosclerotic plaque. Okay, so we see that down here, and here it talks about atherosclerosis. Okay, so we see we have coronary artery disease, cardiomyopathy. Okay, and then they talk in this section here about this process of atherosclerosis. So any blood vessel, especially large blood vessels, get injured, and then the wound healing inflammatory process goes racing in there, but there's such a background of crazy inflammation that it gets out of control. And what happens is blood vessels that are normally this big around, then big clumps of fat form, and you get this kind of occlusion. Sorry, so very little hole is opening, and then you throw a clot and it's closed. Poof, okay, when that happens, okay, you reduce the flow of blood to your heart muscle. Okay, whether it be the blood vessel going from this big around to this big around, or if it clots, but if even it gets this big around, over a lifetime, over 15, 20 years, where you're just not getting the nutrients delivered to the heart muscle as it's beating all the time, it fatigues, and it will slowly die off. Okay, and so you start getting heart failure. Okay, and that's again what this whole section is talking about right here. Okay, so it's because of reduced blood flow to the heart muscle. Okay, if it occludes, then you have a whole stretch that completely dies off. That's a heart attack. If it occludes in the brain, it's a stroke. Occludes in the kidneys, then you'll lose your kidneys and things like that. Okay, and so just go ahead and read through this. It talks about all the different things that happen. Diabetic cardio, okay, that's the heart. Myopathy, okay, that means myo means muscle, okay, right there is muscle, and pathy means the pathology, okay. So this talks about the pathology of your heart muscle that is a consequence of this heart failure related to the diabetic condition, okay. Alrighty, so what I encourage you to do, because again, this is the #1 cause of disease, also called morbidity in our country, and the #1 cause of death, okay? So diabetic cardiopathy, okay? Cardiomyopathy, diabetic heart conditions, the diabetes condition, this is all the #1 issue in our country. So you can, again, watch the elaboration of atherosclerosis. Just remember that the driving force on this is the development of diabetes, okay, and the inflammation that happens from that. Also, when the fat cells get bigger, they start releasing free fatty acids in the bloodstream, and then you get the atherosclerotic plaque that they show developing in here. And this is why you have to have your blood lipid profile done annually when you get to a certain age. I get it done every year for myself just to make sure that I don't have high cholesterol, that my HDL is high, that my LDL is low. That I have hopefully low levels of inflammation. That's your CRP or C-reactive protein marker. Okay, these are the kind of things that you're going to be looking up. Okay, you take the quiz and you're good to go. Now, do remember that this background information will be applicable, okay, to what's up and coming, and you do have your next CT2. It's coming up pretty quickly, October 22nd. Today's only the 2nd. Yesterday we had Hurricane Rosa, had some really good waves down at Trestles, okay? And so this, again, was CT1, and I hope you guys see the utility of this World Data Bank. You can use this for your own research products, for your other projects in school, or maybe someday in the workplace if you need access to data. This is amazing, the kind of data mining you can do in this website, okay? So here's CT2, okay? And CT2, then we're going to be linking everything from heart disease to atherosclerosis to what we study next time, and that's Alzheimer's disease. Okay, and you'll see that 88 over 80%, over 80% of Alzheimer's cases have diabetes, and so they are all connected because of the bad blood vessels, the inflammation. It just goes hand in hand in hand. Okay, so again, no time like the present to prepare for that. Okay, now since this is the #1 cause of disease and death, diabetes is also a major driving force not only between heart disease, not only for Alzheimer's disease, but also a driving force for cancer. And so it's kind of pertinent to look at your discussion this week, and your discussion comes right in here, and we see that it has to do with caregiving. Okay, when your grandparents, your parents, or just older people as a society become unable to care for themselves because of disease or just because of accelerating old age, we need to have these caregivers. Okay, so this is a great video just about the role of social workers. We have the top program in social work in the country at USC, so it's certainly worth something looking into. And then this talks about right here about the issues that they have to confront. Okay, and it goes into elder abuse, whether an older person is neglected by their family. Okay, so that's one form of abuse called neglect. You can have physical elder abuse. You can have emotional elder abuse. And right here, this one right here is a big one: financial exploitation, where you call them con men, but con people, okay, will get in there and convince older people to release the control of their assets, and they become devastated. Okay, so these are all really important issues for you guys to consider. Okay, alrighty, so that's it for this week. I encourage you when you go into the website, we see right here for the National Heart, Lung, and Blood Institute, to show some curiosity. Okay, look into this. Maybe you have a family member that has these signs and symptoms of combination. Find out about it. Find out what you need to do for screening, prevention. Find out about diagnosis and treatment. Okay, so because you know what, power comes from the knowledge that you gain. Okay, and I really encourage you to seek the power of having increased knowledge about these disease conditions. Okay, be an advocate for your parents. Be an advocate for your grandparents. All right. We'll see you guys next time.